Today we have with ourselves Dr. Vikrant Gaikwad, and he has scored rank around 4,000, and he will introduce himself. Please introduce yourself.
So, hello everyone. I am Dr. Vikrant gaikwad. I am from Pune, Maharashtra. I have done my UG from Dr. Ullas Patil Medical College in Maharashtra, and I have secured a rank of 4,324 in NEET PG 2024.
So, was your institute private or public?
It was a private institute.
It was private institute. So, how was the education there?
The educational aspect of my institute was good. I would say the teaching was at par. In fact, the teaching was good in the first, second year. And obviously, in the clinical years, teaching takes a backseat, little bit of a backseat. But all in all, it was a good experience. I had a good NPPS.
Okay, so what do you find difference in between preparing for this NEET PG in a government institution or in a private compared to private institution?
So, in a government institute, you will have a leverage with the amount of exposure that you will have. Your colleges will be in a proper city, so you'll have a larger crowd coming to your clinics. You will have better clinics. You'll have more number of people teaching you. The people you are studying along with it will be slightly smarter than otherwise. While in a private institute, you have a little more time to yourself because the patient load is relatively less. It is not very less, but it is relatively less. So you have more time and you are more aware of the surroundings because it's a small unit, so everybody knows everybody. So it's a nice harmony-based process.
Okay, so how was your studies like? Were you a topper kind of student or a mediocre student?
Uh, Throughout MBBS, I believe from second year, I would be among the top five students, maybe in the university exams. I would score around like 70-75%. I would score.
Great, great. So, what were your sources? What sources you followed?
Uh, I have followed, honestly speaking, I followed multiple sources, but it was confined to subjects. Like I have done some subjects from a particular source, and one subject from one source was my strategy.
Okay, so you have largely, if you can tell which subject from where, then it would be of help to people listening.
Okay, okay. So I've used dams for majority of my subjects. Apart from that, I did a few subjects from BBMCI, which were anatomy, ophthalmology. These subjects I have done from BBMCI, and then I have done Marrow ENT from Marrow and biochemistry from Peptide.
Okay, so the majority of you have done from dams.
Yes, because I was a regular batch student at DAMS since my third year.
Okay, so right now BTR is famous in market. So have you ever seen those things, and how you? I mean, have you ever seen those things?
Yes, I did watch VTR only when my exam was postponed one night prior. So, like we had an exam on 23rd and 22nd night the exam got postponed. So, by the time I was completely prepared, so I did not know what to do further. So, then I was like, I should try my hands on VTR. So, I have watched VTR in the last 1 month. I watched it for a couple of days, like about 15 days, and I finished all of it the like BTR plus bonus BTR videos. I couldn't revise all of it, but I just watched most of it, all of it, and revised some of it.
Did it benefited you?
Yes, of course it did. Of course, the way in which Dr. Zainab covers the content, uh, the way she concises everything, and the way she puts it forward, I believe it's a really nice resource. But saying that, I would also like to say that it is of no use unless you have a base. It's something which it's like a booster. If I have to compare it with vaccines, first we follow the schedule of the vaccine and then we get the booster. So BTR is more like a booster instead of being like the vaccine as per schedule.
Okay. What was your rank in May INI?
My rank in May INI was around 7,000.
So, what you did in between that rank improved in NEET, apart from BTR?
I tried to focus more on revising my TND notes because TND notes were more concise. And also, I worked at solving more MCQs in this phase. Though I was always solving MCQs, but this time in this period, I tried to solve more and more questions and analyze them properly. And I gave another 3, 4 JPs in between.
So, which shift was your exam?
Second,
Second shift. So, how many of the questions you attempted?
I attempted 197 questions. 3 questions I left.
Okay. What were those three unlucky questions?
One was about the cholera vaccine, which I had no clue about because it was like a recent advance by Bharat Biotech, and I had no clue about it. Another question was about some random PSM update, which I don't even remember right now. And the third one was about that ambu bag pressure valve.
Okay. So, how much if you have seen recall, so around how much you have got correct in those things?
I did not check the recalls, but in my opinion, I must have gotten around 165 questions correct.
Great, great. So, what will be your message to your juniors? I mean, those who are watching you.
My message to anybody watching me would be never rule yourself out, believe in yourself, and prepare consciously, prepare methodically. Hard work is important, but if you add a conscious hard work as an element to your preparation, it will take you places.
So, okay, fine. What branch you would be taking?
I would pursue medicine.
Medicine. Okay. MD or DNB?
Uh, I am okay with either. That I'll decide based upon the counseling.
Okay, great, great. So it was really great having you on my channel and best wishes for your future. Thank you.
Thank you so much for having me. Thank you.